Pathologic features of asthma CCC charcoal laden crystals, Kirschman spirals, Crayola bodies. Charcoal laden crystals are derived from it's crystal, right? So the crystals are from the granules of eosinophils only found in asthma. Kirschman spirals, twisted casts of airways, whorls of sheer epithelium. Twisted cast of airway and whorls of sheer epithelium. Crayola bodies are clumps of cells or isolated metaplastic cells. Clumps of cells, isolated metaplastic cells. Charcoal-laden crystals in the sputum in asthma. Kirschman spiral is spiral-shaped mucus plug in the sputum in asthma. Particles of size less than 2.5 micrometers can be carried to the lower airways. Particle size above 10 to 15, because of their settling velocities in there, they do not penetrate beyond the upper airways. Those between 2.5 and 10 deposit relatively high in the tracheobronchial tree. The okay. So based on the size you're saying, we are going to categorize the particles into those less than 2.5 microns, those between 2.5 and 10 microns, and those between 10 to 15 microns or larger. Okay, so those which are lower than 0.25, sorry, lower than 2.5 micrometer is going to go to the lower airways. 2.5 to 10, the high up in the tracheal bronchial tree. 10 to 15 micrometers, they are going to settle, they don't penetrate beyond the upper airways. Symptoms of the triad, so that was about the particle size. Okay. And then we move on to the symptoms of asthma. There's a triad of symptoms, WBC. B is a pathognomonic feature. B is breathlessness, otherwise called intermittent dyspnea. And C is cough, which is often nocturnal, and a dry cough. That could be the earliest feature. Increased length of expiratory phase of respiration. Okay, that is another thing. Extra point in when the nocturnal symptoms will be getting worse. Nasal polyp and sensitivity to aspirin occurs in asthma is called the Samter's triad. Okay, so that was about it. Clinical features, symptoms over signs. Signs, the respiratory rate is high, and when we are and then when we are doing auscultation or percussion, the chest will be appearing to be hyperinflated. Okay, hyperinflated chest. And then we are going to try to listen to some sound. We hear audible V's and a polyphonic rhonchi. Increased length of expiratory phase of breathing, and FEV1 is less than 50%. So these are the signs. The respiratory rate is high, there is hyperinflated chest, and then a wheeze will be heard, a rhonchi will be heard. The wheeze is an audible wheeze and a rhonchi is a polyphonic rhonchi. And then increased length of the expiratory phase of breathing. FEV1 is less than 50%. Features of severe attack are also there. Severe attack naka. Okay, severe attack is different. Life-threatening one is different. Okay. Features of severe attack includes inability to speak complete sentences in one breath, pulse rate more than 120 per minute, respiratory rate more than 25 per minute, pulses paradoxes are more than 10 mmHg, FEV1 between 33 and 50 percentage of predicted. Inability to speak complete sentences in one breath, pulse rate more than 120, BP la pulses paroxys more than 10 mmHg, respiratory rate 25. Okay, pulse more than 120, respiration more than 25. FEV1 between 33 and 50 percentage of predicted. Pulses paroxys more than 10. Inability to speak complete sentences. So that was about clinical features of severe asthma. Features of life-threatening asthma. Life-threatening lavanda, there will be silent chest, so we won't be hearing any respiration. Okay, and then there is respiratory acidosis, and then because the chest is silent, there will be low oxygen and high CO2. But main thing is there will be hypercapnia. Cyanosis will be there. The heart rate is less, bradycardia. Confusion manifesting as altered sensorium. FEV1 is less than 33% of predicted. So FEV1 is literally the one thing which is common for both severe attack and life-threatening attack. FEV1 of 33 to 50 percentage of predicted is going to be severe. Life-threatening, it has to be less than 33%. Okay, thank you.